Okay, good afternoon, everyone. Thank you for joining and welcome to the American Muslim Senior Society Advanced Care Planning Training for our lovely ambassadors. First, I would love to go over some quick Zoom housekeeping instructions to better facilitate this meeting. But before that, please join me in thanking and welcoming the Jewish Social Service Agency, also known as JSSA, represented by Mrs. Valeria Walker, for hosting this training. Mrs. Mona Negim, the founder and the director of the American Muslim Senior Society, will introduce our speaker to you. Go ahead, Mama Mona. Unmute yourself, Mama Mona.
Can you hear me?
Yes, go ahead.
All right. So I just want to say welcome to Valerie Walker for giving us the honor of her training today. Just to give everyone an idea of who Valerie is the Advanced Care Planning Trainer at the Jewish Social Service Agency. In her role, she develops advanced care planning, ACP, training and delivers ACP training to community partners. Valerie has a passion for promoting ACP and recently won the grand prize at the 2019 Boom Conference Pitch Competition for her ACP presentation. She received her master's in Management of Aging Services from the Erickson School at the University of Maryland, Baltimore County. She sits on the National Hospice and Palliative Care Organization as an advisory council. She's also an International End-of-Life Doula Association trained end-of-life doula. So without further ado, we would like to introduce you to Valerie and let her have the floor and let her have her training. Welcome, Valerie.
Thank you. Thank you so much. I appreciate that introduction and I welcome everyone here today. Malik, do you want to make me the host or am I the host currently?
Yes, give me 1 second. Go ahead, it's all yours.
Thank you. So is everyone hopefully able to see the presentation now? Can you see the presentation, Malik? Yes.
Yes, we can.
Okay, all right, thank you so much. All right, so again, thank you, Ms. Mona, for introducing me and putting this together. I am happy to be here today, just trying to juggle through some last minute technologies, which always seems to kind of catch me right before I do a presentation. I am presenting on a different computer that I normally would not be presenting on. So if I have to work through some issues, I would have just appreciated if you would give me the opportunity to do that. On the line with me is the project coordinator, Sarah Hufstadter of Voice Your Choice. She's waving at us now. She's been a great support and also a hard worker at making this Voice Your Choice program successful. So thank you, Sarah, for being here with us today. So we know that you're going to have questions during the webinar. Please use the chat box to ask any type of questions. We will provide questions and answer a mini session, I call it, at the end of the webinar to ask any similar related questions that's related to the content that I'm going to present to you today. If things get too technical or too complex, I will have a slide at the end of the presentation with my phone number and my email address that you can contact me and I can, provide more personal one-on-one question and answers for you. I got into advanced care planning really. I lost my mom in 2011. She had a chronic condition that was declining and had been in the hospital in and out for, I would say, over a year. And towards the end, we wound up putting her in a hospice facility, which she was aware of at the time. But once we got her into the hospice facility, medications were beginning to be administered. And my mom went to sleep within 24 hours of being admitted into the hospice facility. Within 5 days, my mom had never woke up. We really didn't have our lasting conversations with her. My brother was in flight. And so I remember just sitting during that time saying, you know, this has to change. You know, and when I've talked to people in the community, I don't have the worst, I guess, story. I don't have the best story, but it's my story. And so I remember sitting in her room saying, you know, I have to make an impact. I have to make a change in the community. If I just start in 2011, and if I can just impact one family member to change the outcome by having advanced care plan in place that will empower them to make informed decisions, whether it's a healthcare emergency or end of life emergency. That's what I really wanted to do. And so that's how I really got into advanced care planning. And my path has been opening up ever since then. And so the more I talk about advanced care planning, it seems like the more I have to talk about advanced care planning. And with the pandemic, now is the perfect time to talk about advanced care planning. So that's a little bit more about my introduction. The agenda today is that I will overview the Voice Your Choice program. We're going to talk about advanced care planning. Why is it important? We're going to talk about what is a healthcare agent, how to choose one. Then I'll go into our live website and I'll show you how to create an advanced care plan and also build an advanced care plan. And then we'll do some wrap up and next steps. Now, when I transition into that live, you can just kind of hang with me and, you know, because it starts getting very detailed. And we have, maybe 13 people on the line. So if you come back and you need additional help with one-on-one training, we provide additional trainings where I show you how to upload a third-party document. We have one that's coming up one day next week. I have them pretty much the last Tuesday of every month at 11 o'clock. And then I also have a live session where I'm just strictly answering questions that I don't go over the agenda. I don't go over the presentation at all. I'm just opening up dialogue for us to have a conversation for anyone who wants to ask me any questions that don't get answered in this presentation. And again, I have my slides so that you can contact me one-on-one or or through an email. You don't have to worry about taking notes if you request for this slide presentation. We will send the slide presentation to you. So here we go. The Voice Your Choice program. Like I said, Sarah has really been working very hard and diligently with this program to make it very successful. So we really are excited about promoting advanced care planning through local community trainings and bringing about public awareness and education. We initially started out face-to-face. We had a couple of face-to-face trainings at JSSA, and with the pandemic happening, we quickly had to pivot it to a virtual setting. And so here we are back and forth and ready to promote this program. We also look to motivate people 18 years and older to really think about and write down their healthcare wishes, because again, I'm going to be talking about COVID since that's pretty much in our face every day, you know, and it's affecting everyone. There's not, you know, we first thought it was seniors, but no, it's impacting everyone. And so motivating people 18 years and older is a group that we need to talk about and look at. We also encourage them to talk to someone or choose someone to advocate for them if they're unable to speak for themselves. We also are going to provide you with the free online planning tool. That's when I'll be transitioning to another website to show you how to create your account. And again, the Voice Your Choice program is a program of Nexus Montgomery, led by the Jewish Social Service Agency. We have a disclaimer here. Voice Your Choice is not responsible. I am an advanced care planning trainer. I don't have a license to practice medicine, and I am not an attorney. So I will not be offering you any medical or legal advice. And you will see on one of the slides that I'll be showing you later on the website that it does have a lot of medical terms that you can click on and get definitions for, but I will not be offering medical or legal advice. We are not responsible for any type of technical malfunctions with the website that I will be showing you. And we have no control over your provider viewing or following your advanced care plan. So please keep that in mind as I move forward. We have an opening survey, and if Sarah has the power to type that survey into the chat box, the survey is anonymous. Do you have that ability, Sarah?
Yes, I do. I'm doing that right now.
Okay. So the survey really helps us to cater our trainings, especially now moving from face-to-face to virtual. We really want feedback from our attendees and our participants to let us know if we're on point with this, you know, if we need to change something. We are constantly evaluating our feedback. Again, it is confidential, but it helps us to learn better about how to present this material to the community. So if you would take a couple of minutes to do that, I would appreciate it. And how are we looking, Sarah?
Right now, I think people are still in the middle of a survey. What we can ask is, we'll give you another, minute or two, Val, and I think that should be good. Thank you.
You're welcome.
And this is Sarah. I would just ask if you need more time, could you please let me know in the chat box and I'll let Val know. Thank you so much. It looks like people are done. Thank you, Val.
Okay, thank you. So we are here to talk about what is advanced care planning. So with COVID-19, during this COVID-19 pandemic, it is really crucial to educate people and to let the community know that it's critical to have an accessible healthcare plan or an advanced care plan that is accessible to your physicians and also to your family members, particularly if you are in a high-risk population. If you have underlying chronic conditions, having an advanced care plan electronically that you don't have to worry about being in a paper form is really critical during this time. And so this training really is specific for anyone who wants to go out into the community, which today we have our ambassadors who want to go out and empower the community to be able to make their own healthcare choices if they become unable to speak for themselves. In order to effectively empower the community, you have to empower yourself. And so having your own electronic advanced care plan, excuse me, during this time is also equally important. So what is advanced care planning? Advanced care planning is making choices about the care you will want if you're unable to speak for yourself. Advanced care planning is personal, it's based on your beliefs, it's based on your faith, it's based on your values, it's only personal to you. Nobody can substitute in your preferences for yourself that you have in an advanced care plan. So you really have to say, yes, this time, this plan is all about me. I am making these choices. This is how I want to be honored. This is the guide that I'm providing to my medical professional team. And I'm also providing to my family to honor me if I ever become unable to speak for myself. Why is advanced care planning important? Well, I just talked about COVID-19 is a primary reason right now as to why advanced care planning is important. It gives you the power to be able to have a say in your own type of care if you become really unable to speak for yourself. It increases the likelihood that your family members and your doctor will follow your guide because you are now providing a plan for everyone to be on the same page. It also reduces, the guilt and the burden of families having to guess what type of medical care you will want in a medical crisis. And I mean, when we turn on the TV, the first part of COVID in March and in May, that's all we saw was someone, a nurse filling in the gap between a family member that was in the hospital and a family member that was at home. And the person that's in the hospital was on the ventilator and the family member really cannot engage. What is it that you want? Well, do you want to be on a ventilator for 2 weeks? Do you want to be on a ventilator for 3 months? And so having an advanced care plan with that selective healthcare agent is really important because even today that's still happening. And you do not want to leave the burden. I mean, with all the anxiety that's going on in the world, the political arena, the injustices that are going on, all the thoughts that we are dealing with during the nighttime, to be able to take the pressure off a family member, having to guess what type of medical care you want is a big relief. And so that's one of the reasons, again, why advanced care planning is very important during this time. What is a healthcare agent? A healthcare agent really is someone who knows your healthcare wishes and can share them with your medical provider if you are unable to speak for yourself. A healthcare agent can only make medical decisions for you. So it's two things I'm saying only for. They can only make medical decisions for you if you become unable to speak for yourself. So they can only make medical decisions, and it's only if you become unable to speak for yourself. So your healthcare agent cannot say, okay, she's in the hospital, let's sell a house, let's withdraw the money from the bank account. Oh, I want the living room set. Your healthcare agent cannot do that. It's only medical decisions. And again, we see people surviving from COVID. So if you have a healthcare agent and you are medically induced and you're on a ventilator for a week or 2 weeks, that healthcare agent now has the power to make those decisions along with your doctor about the type of care you have documented to honor you. Once you begin healing and recovering and coming off the ventilator, and now you're being dismissed from the hospital, you now have the authority to make your own health care choices and wishes, and your healthcare agent is now no longer in control of your healthcare wishes. So again, they can only make healthcare wishes, medical, decisions based on your medical care, and it's only when you are unable to speak for yourself. A healthcare agent should be someone that you trust. Your healthcare agent can be your spouse. Your healthcare agent can be your children. Your healthcare agent can be a coworker, another family member, a niece, a nephew, your best friend. A healthcare agent is really someone who gets in there and they advocate for you. So it has to be someone that you know that will say, you know, this is what's documented in her healthcare plan. And so why are we moving away from what's being documented in her healthcare plan? And how is it that what you're doing now is going to have a different effect on his or her healthcare plan? So a healthcare agent needs to be someone that you can trust, someone who you know can handle dealing with the medical team, someone that you know will question the doctors until they get the answer that they are satisfied with, as long as it's honoring your wishes. So again, it's important to think about your healthcare agent and not really think that automatically it will be someone else. It has to be, in my case, my sister does not do well. She does not do well in a medical in a hospital setting. So my healthcare agent is my son and then my girlfriend. And so we also recommend that you have a second healthcare agent just in case that first healthcare agent is not available. Because again, what we've seen on TV is you have a family member in the hospital and the primary caregiver or the main person that's at the house is now starting to have symptoms of COVID-19. So now you have two people that are head of the household, with these symptoms, and then there's nobody else to speak on either of their behalf. So having a second or third healthcare agent is something you really need to consider. Your healthcare agent really is required in the state of Maryland that they must be 18 years and older. And your healthcare agent cannot be your doctor, so that you will avoid a conflict of interest. So here are some questions to ask your healthcare agent, like I say, to kind of really decide if you are picking the best person for you, and to also let them understand what it is that they will be asked of or their responsibilities. And the questions are you willing to talk to my doctor to understand the medical care I'll need if I'm too sick or not able to speak for myself? Are you willing to make decisions based on the wishes in my healthcare plan? And also make sure that you have a conversation with your healthcare agent and say, if this happens and the doctor says this, or if it's more important to you to have a quality of life, and the doctor is saying, well, this procedure is not going to give her a quality of life, then you may want to talk to your healthcare agent so that they can be flexible and not really look directly at your your advanced care plan, but to allow some flexibility in that advanced care plan, because it's impossible to think about all the different scenarios that we can get ourselves into when it comes to medical crises. No one was thinking about COVID-19 last year, so you need to also make sure that your healthcare agent will follow your plan, but also be flexible according to you know, the things that you want as far as providing yourself a quality of life. So I'm going to switch to the advanced care plan. I'm going to go through a couple of housekeeping slides, and then I'm going to go to our live website. So the next slide, we're going to start talking about setting up your account. The first place you want to visit to set up your account is www.voiceyourchoice.org. I'm going to have a drink here because my voice is a little raspy, excuse me. Thank you. I'm hoping everyone is okay. You all can give me a thumbs up because I'm getting ready to transition. I want to make sure I haven't lost anyone. Am I talking too fast, moving too slow? Everybody's okay? We're okay? Okay, good. Thank you for that. So when you go to the voiceyourchoice.org website, the first thing you're going to see is the Voice Your Choice logo, which lets you know that you are with us. And you will see the green button that says Complete and Advanced Care Plan. Once you see the, once you click on the green button, you're going to go to the Voice Your Choice My Directive Advanced Care Plan platform. And if you haven't set up your account and this is new for you, you're going to click on the New User button here. That's going to take you to setting up your account. You will see again the Voice Your Choice, and it's going to say create your My Directives account. You want to put in your first and your last name. You want to create a username for yourself and an email address, and also put in your date of birth. And make sure that you write down your username and your email address, because now you're going to begin going through an email confirmation verification process. So here we are at the confirmation process. Now, since this more than likely is your first time receiving an email, you want to make sure that you check your spam or your junk folder. You want to immediately click on the blue continue button, which will prompt you to set up your password. So make sure again that you write down your username, your email address, and your password, and then you can continue. When you continue, just go right back to the voiceyourchoice.org website and go back in as a returning user. So I'm going to stop right now and try to go into my live website. Okay, I am returning as a user, returning user. Here is the Voice Your Choice logo. I'm a returning user. Here's my username that I've written down. Here's my password. I'm getting ready to sign in. I'm here at the My Decisions tab. Can everyone, can you give me a thumbs up and let me know that you are seeing the, all right, okay, we are doing wonderful today. Thank you for your participation. Thank you, thank you. Okay, so this is where we're gonna hang out most of the day. So this is actually a live website that I'm on. This is my dummy training website. So a lot of things I already have built in. Of course, you're not gonna see the same thing if you're creating your advanced care plan online for the first time. But remember, in order to influence and empower those that we love, our family members, and as we go out into the community, we have to empower our own selves to make our own decisions. And we understand that it's not going to be a one-time conversation. You know, this takes time. But with COVID-19, we suggest that when you create your account, the first thing you do is to go into My Decisions and you at least select the healthcare agent. Now, if you need help with talking through this with anyone, you see on the right-hand side, these are 1 to 2 minute videos that are available to kind of help you talk with other individuals about being a healthcare agent. And as I go through each one of these, you'll see on the right-hand side, there's always a 1 to 2 minute video. So here I am, and I have selected Ms. Jane Brown, and I've selected my secondary person, just in case my first person is not available. On the right-hand side, if this person, if Ms. Brown decides to get married or have a name change, hyphenated, or for whatever reason, I can edit that. If Ms. Brown says, you know what, Val, I got a lot of things going on in my life. I just don't want the responsibility of being a healthcare agent at this moment. I just go in and I remove her. You can also add her back. So this is an area that you can take the time to play in, to get adjusted. You're gonna have plenty of areas that you can kind of play in this area. Also, this is a list of powers that you grant your healthcare agent. And you can see if this is pretty intensive. So you can actually copy and paste or either type this area in this particular area. So if this is too much, you click on the second button and you see this free text area. And I can highlight this and copy and paste this here. Okay. Also, if you have more than one child and you want your children to have equal access or equal ability to speak on your behalf, you write both of your children's names here. So this is an excellent website. It's very user-friendly. It records as you go, but you still want to do a save and continue. So always make sure whenever you work on an individual, it doesn't save as you go, but you need to make sure that as you're working in each one of these areas that I'll be taking you to, that you click save and continue. The next area, because of COVID-19, and we can say that COVID-19 is a certain circumstance. So we will say go to My Preferences and certain circumstances. So here are our medical terms that I was telling you about earlier. Terminal illness, heart machines, IV drugs, artificial nutrition, and hydration. If you notice, you'll see a underline here and a blue, and they are in blue. You can click on and get your definition here to get a better understanding of what it is that these medical terms are about. Here's your video to the right-hand side to help you talk about my preferences and specific circumstances. We also have a 5-page discussion guide here. We suggest that you print that out. If you are not able to go into your doctor's office right now, print it out anyway. Tell a doctor you would like to have an advanced care planning session and have a conversation with some of the terminology and some of the information that's on the discussion guide. Print it out for your family members so that they can have. Take it with you if you can go to your doctor's office and discuss the choices with your doctor and your family. And also anything that you do in this area, make sure that you click save and continue. Another area we're going to take you to is my advanced care plan. My advanced care goals. And the first thing it asks you is, what is important to you? And that's why I was stressing this in the beginning. This whole plan is about you. It's about, you know, you want to take your family member into consideration, especially if you are in a situation where you may be living with your children or they may be living with you and you have grandchildren. But for the most part, you definitely want to make this plan personal to you. And so the left-hand side works with the right-hand side. So if you can see where I now have 7 priorities, if I now want to make other things that are important to me about life and health, if I just click on that, all I have to do is click on it. And now you can see it's number 8. And I can type in those other things that are important to me. If I decide that being, not being a financial burden to my family is no longer an important priority, I can just click this X right here. And it's now gone. And now you see I'm back to 7 priorities. If I decide that resolving conflicts, I want to move that up from the position of 6. All I have to do is click on this. And now you see that it went from position 6 to position 2. So again, this website is very flexible, is very user-friendly. The benefit of using it is that it's a website. It's open 24 hours, 365 days a year. It's secure. It's easily accessible by your doctors, by your medical staff. It reduces your healthcare agent having to carry, you know, your paper document or your paper advanced care plan. And so these are some of the main reasons why Voice Your Choice is supporting this online advanced care plan. We're gonna pop over to My Circle. You can add contacts. So you see here, I have computer running a little slow, but you see I've added in 3 contacts here. And you can also see, you can give them search and access. So you see Miss Jane Brown, my first healthcare agent, my primary healthcare agent. I have not decided to give her all access to my documents, but all I have to do is edit it here if I want to change it. You see Miss Nicole Ben is a contact for me, and I've decided to share all my documents with her. So you can change, this is another area you can play in, and you can delete them or you can change what type of access they have. And this talks to you about the access if you have any questions about giving and setting access for your contact. So here we are almost towards the end. We're coming out the My Decisions area where we stayed at most of today. We went into the My Circle just to talk about the contacts. I'm gonna head to My Dashboard. Now, some people have a paper document, or they may wanna upload other things to this electronic platform. You see in this blue area, it says upload, document upload. You click on document upload. You will see where I have put some documents in this test website. I'm going to look at 5 Wishes because that is a popular paper advanced directive that many people use. So you see here that I have 5 wishes. The only thing that we want to say is that anything that you upload here, as it applies to your personal medical decisions, the doctor will always look at the most recent date. So make sure that you're not overriding something that you really want to be a priority. And again, you can edit and delete here. I always like showing this. This was very simple. I wrote a note on a piece of paper. I took a picture with my phone. I connected my phone to my computer and I uploaded the document. So you can upload letters of endearment, apologies, family discussions, anything that you, that you find valuable, and you just put it on your computer, select the file here, and it'll go to your computer, or you can take a picture and do a drag drop here. So, and again, do save and continue. So now we've built everything, right? We put things that are priority to us. We've uploaded any third-party documents. We've selected our healthcare agent. We've talked about our medical terms with our doctor. And so now we're ready to sign the document. So before you sign the document, what you want to do is, if you've selected your healthcare agent, you've had your conversation with your healthcare agent, and they're giving you the thumbs up and saying, yes, I want to do this for you. You want to tell your healthcare agent that once you sign your document, they will be receiving an email. And that email is going to ask them to do the same thing that it asked you to do when I first started talking about setting up your account. So it's going to ask them to put in their name, their last name, first name, an email address, and a username. They're going to have to go through the confirmation like you did with checking the junk box, checking the spam box, setting up a password, and then returning back to the voiceyourchoice.org website. And what this is actually doing is confirming that you have selected this person to be your healthcare agent, and that your healthcare agent is agreeing to be your healthcare agent. They don't have to go through all the my decisions and the my contacts, and the only thing they have to do is set up the account so that they will have access to your information. Otherwise, they have no way of getting into your account. So they do have to set up an account. So at this point, after you had that conversation, everybody's good to go. You want to sign your document, save and continue. This is your account information. You want to put in your first, last name, date of birth. You're going to go through an identification verification process. Some things here are optional. Really, this is a third layer or a security way so that the doctors can verify that you are the patient that's in front of them. So this information is actually matched through a third-party database that your doctors have access to. And it just verifies and ensures that you are who you are, that the person that's accessing your information is who they are. And, your information is never sold or distributed by this third-party website. So it's an extra layer of verification. So I'm going to go back to my slides and try to pick up where I left off. So I am back on my presentation now, and I'm going to take us to where, this is where I left us, this verification process. Sarah will be typing in a closing survey. It is anonymous. It looks very much like the survey that you did earlier. This is just saying ACP3. It evaluates me. You can let us know, it is anonymous. You can let us know how I'm doing, any suggestions you have for me, any suggestions you have on the slides, the website. It lets us know if you're learning anything that we taught you today. And again, we value the feedback. If there's anything, Sarah, you want to open with or close with before I continue to the questions and answer session?
Thanks, Val. I was just typing something into the chat box.
Okay.
No, I just wanted to thank everybody for taking the time today to learn more about Voice Your Choice. We think it'll be a really useful resource as you go out into the community and share information about advanced care planning. We're happy to answer any questions. Val's also having a webinar on Tuesday, and it's just a question and answer webinar, so she'll be taking individuals' questions during that time. So if you have additional questions that don't get addressed today, she'll be available on Tuesday to be able to answer those questions for you. And we would love to be able to have you share this information with the community. We have other resources on our Voice Your Choice website, and we really encourage you to go ahead and take a peek around there. Thanks so much.
We have any questions in the chat box?
Okay, thank you. Does anybody have any questions? Can you please raise your hand just to see it? Okay, Mr. Habib, can you unmute yourself and go ahead and tell us your question, please? Okay, unmute yourself and go ahead.
Can you hear me?
Yes, sir, go ahead.
Thank you, Ms. Walker and Sarah. I learned a few new things, that I did not know.
It's all right.
So I sent a private email to Sarah. I don't know whether she was not sure what Muslim compliant will is, in case there are some things that pertain to us in the Muslim faith that things like organ donation or certain things, I don't want to deviate, but they have, you want certain things that will be compliant with your religion. Same thing with the Jewish, in case you pass away to get the early burial and things like that. That's a whole subject by itself, but I think I suggested that in the survey that you should think about talking about that for whether it's Jewish or Christian or Muslim, because we have our own, I shouldn't use the word Sharia, but Muslim compliant, wills that some people like donating organs or alcohol or pig medications that have porcine and things like that. I'll give a typical example, which is related to what I'm saying. When I was doing my implants, I found out that some of after they uproot, they put some cadaver into your mouth so that it will grow before they put the real implant. And I found out that it was from pig, but I caught it on time, and I chose the bovine one instead of the porcine one. So these are the kind of things, but I think it will be in your things when you fill them up. If you can add anything to that, Ms. Walker or Sarah, anyone. But thank you very much. I learned quite a bit.
Thank you. I think you bring out a good point. That thinking about others' cultures and others' preferences, faith and religion is very important. For now, what I would suggest is that area where I showed that you can upload, a document, that blue area that I showed you towards the end under my dashboard. I would suggest that you would use that area if you have a form that's particular with the things that you were just talking about, for example, organ donations or any type of medical procedures that's specific to your own beliefs, then I would suggest you would use that area to upload, that document so that the doctor will be aware, to not go to the standard, the standard way of doing things, but that based on your own faith, you have some additional things, or your own religion, that you have some additional ways that you want your medical care to be handled differently. So I would definitely use that document upload to personalize my plan even more so.
Great, thank you. Does anyone have any question? One more minute.
I got a quick question here.
Go ahead. Yes.
How are you? Can you highlight the importance of having a will to any living soul, regardless to the age of the person? Do we have to wait till we get older to have a will, for example, or we should do it early? And I know what is the Muslim faith and beliefs when it comes up to having a will, but I'm more focused on the legality or the legal part based on the system that we have in the US. And thank you for your time.
So this is talking about an advanced care plan. This is specifically to your medical decisions. A will talks about your finances, your real estate, your things. So this is specifically talking about an advanced care plan. I am, well, let me share another story with you. As I began to talk to my son about what I wanted or how I wanted to be honored, when my mom first passed away, my son was like, "Oh no," he was 22, right? Who wants, a 22-year-old does not want to have their mom come talk to them about, what they want to honor, how they want. So he's like, no. But I mean, he would come into the house. I mean, I wouldn't hit it with him, hit him with it every time he walked in the house. But, it got to the point where he said, "Mom, you're just not going to give this up, are you?" And I'm like, "No, I'm not going to give this up." Well, I'm amazed every time I have to say this on a webinar due to transparency to help others. But last year, now this started in 2012, my mom passed away 2011. I started, talking about it 2012. And I'm talking to my son about what I want. And last year, my son turned 29. He turned 30 in May of this year. But December of last year, my son walked into my home and he told me exactly what he wanted me to do to honor him. Now, he hasn't documented it yet, but to say, do we have to wait until we're old? No, this can be done. The program motivates anyone 18 years and older. So as long as you're 18 years and older, you can create an advanced care plan. And so I just wanted to give you that example, with my son. And I suggest you have the conversation, because I was not thinking about what my son actually wanted. So really unintentionally, by us not having a conversation, we can unintentionally dishonor our family members. And those are the people that we love the most. So we have to have the courage to have the conversation, because what my son told me he wanted was not what I would have done, and I would have unintentionally dishonored him. So and I even say, if you have children, grandchildren, and the goldfish die, that's a perfect opportunity to talk about advanced care planning. If something happens to the cat or the rabbit, use those opportunities to talk about if someone's getting married, if there's a funeral, if a student is going away to college, any type of major life crisis that's going on, whether positive or negative, have the conversation about advanced care planning. So no, you do not have to wait till you get old to have an advanced care plan.
Great, thank you for the answers. Just a quick comment here. Can we somehow connect our medical plans with our wills, legally without any troubles? Or are those like two completely different, things, and we cannot connect our medical plans and wills with our main will? Can we do that?
Well, I would say you can upload them, but it's nothing, your will is nothing that a doctor is going to follow. I mean, if you just want to have everything in one place so that you can print it out and present it and have it, to present to your family member, and then they will have your medical plan printed out electronically and the will attached to it. But your doctor is not going to go in and look at your will because that, like I said, that has nothing to do with any type of medical decisions that he will be making to honor you. So you can upload that will.
Okay.
But it's not anything that your doctor is going to be referencing for you on your behalf.
Great, thank you. And I also submitted the question through the chat. I asked, is it free to sign up? And Mrs. Sarah Hafsider said, yes, it is free to go ahead and sign up for a medical plan. Do you have any other comments to follow up with that?
No, it's accessible. It is a free online tool. You can get in, like I said, it's user friendly. You can practice, you can edit, you can remove, you can go into it at midnight, you can go into it at 7 o'clock in the morning time. So yeah, it's free and open at all times.
And this is Sarah. I just wanted to jump in and let you know that this webinar that we presented today is the webinar that's available to everybody in the community. Val has 9 webinars each month that's available to the community, and those are all free. So all of the resources that we offer from Voice Your Choice are free. And if you go to our website, there's registration links for each of those. So if you have other individuals, either in your family or neighbors or colleagues that you want to share the information with, if you go to the www.voiceyourchoice.org, they can see when that schedule is and be able to register.
Awesome. Thank you so much. Thank you, Val. Thank you, Sarah.
Thank you.
Najim, do you want to wrap up?
Yes, very much so. I want to thank Sarah and especially Val for the excellent presentation she made today, and the time and energy that she must have put in preparing for that. Sarah, thank you so very much for your gracious hospitality, for allowing us to get all this precious information. Really, really appreciate both of you, coming and taking time out of your busy schedule to share this information with us. We appreciate it very much, and I hope the ambassadors have listened carefully, and we are going to be following up with you at some point. And if they have any questions, I think you have like every Tuesday. Is that what you said, Val?
Yes, it's the last Tuesday of every month.
Okay.
And they can go to voiceyourchoice.org and you'll see the registration links under community training.
Wonderful.
And Val has her information up here too, so if you have a question, you can contact Val directly.
Thank you so very much, both of you. Thank you so much.
Thank you. Thank you for welcoming us into your home.
Really appreciate it. Thank you.
Bye.
Okay,
and Malak, thank you for an excellent job. Congratulations again.
Thank you.
You did a superb job.
Thank you.
They don't come any better than you when it comes to technology and everything.
Yeah.
Thank you guys. Okay, Mrs. Val and Sarah, you may leave the meeting. Thank you so much for coming. And yes, thank you.
We have a meeting that follows this one.
Our ambassador.
All right.
Thank you
so much. Thank you so much.
I'm going to try to get out.
No problem.
Okay, hi, our lovely ambassador.
Bravo, Malak.
Okay.
Bravo, Malak. Excellent.
Mama, I forgot to go over the instructions because you gave her the floor right away. I was speaking without a further ado, and then she spoke. So I didn't go over this line. It's fine, never mind. Okay, I will